Let's talk breast cancer now. This has cost 7 African countries over 10 billion US dollars in lost productivity, mostly affecting women in their prime working years. Research at Roche Africa Press Day 2026 shows that every dollar invested in innovative breast cancer treatments generates up to 12.4 US dollars in economic return. Kenya's Empower initiative, which has helped over 235,000 women, was highlighted as a model for early diagnosis and care. Joining us now to further discuss this is Dr. Paul Chilwesa, who's head of policy, population health, and health systems strengthening at Roche Pharma Africa. Dr. Chilwesa, good morning to you, and thanks for making time to talk to us this morning.
Good morning, Asanda. Good morning, Peter. Thanks for having me.
The new analysis shows that breast cancer has cost 7 African economies more than 10 billion US dollars in lost productivity. From Roche's perspective, what are the biggest barriers when it comes to preventing African countries from investing more, particularly in early detection and treatment for breast cancer?
Thank you, Asanda. I think I'd like to start by bringing the $10 billion first on the table and look at this from an opportunity lens. This analysis was done by an institute called WIFO Institute. It's a German think tank that supports the G7, G20 countries in some of these economic analysis. 10 billion, I think the grave news we are hearing is $1 billion is being lost every day in some of the things happening across the world. And we know that in terms of economic impact. And these are only 7 African countries where we're able to gather the right data. When we go back to $1 billion, I think we quickly realize this is not a health issue, it's an economic issue. This is productivity that the economy needs very, very much so in Africa. This is the number that we need to move to our ambition in Africa as a union. Africa Union wants every country on the continent to achieve the middle income status by 2063. That's the number we need to be able to capture. The opportunity, Asanda, thanks for bringing that out, the opportunity that is being missed by the African countries in terms of prevention, early detection and treatment. I think the first part is how do we make sure this conversation is an economic conversation and not a health conversation? Because health alone is not able to capture that number if it's left to health on its own. Again, going back to the number 10 billion, this 10 billion is lost not because we don't have systems in place, but these systems in place are not well structured to capture that number. The woman we are talking about, Asanda, is much younger than the West, but I think we are still highly dependent on a system that is designed in the Western system. So going back to what is the opportunity? The opportunity is how do we ensure this number is discussed at an economic level of what is being lost because we are not doing the right structures, the right connections in the healthcare space.
So how do we make those structures? How do we create them and make those right connections? We've got the figure that breast cancer treatments could generate up to 12.4 US dollars in economic returns. But how do we translate that evidence into policy and budget decisions on the African continent?
Asanda, I like the end part of the question. How do we ensure this is sitting at a budgetary conversation and not sitting at a health outcome conversation? I think the first part is these conversations of the 10 billion being lost needs to move into an economic conversation with commerce, economic development, budget, and treasury. I think that's the first part. The second part that we are very aware of what needs to come through in the healthcare system for us to capture this number. There's 3 elements. There's 3 systemic factors that actually capture this number. And I'll summarize them in a very easy way. Okay. Detect early, treat well and fast, and manage well. So detect early is basically saying when the woman has a lump, how quickly do we get the diagnosis? Because time costs a lot of money, and that's where the money has been lost. The second element is treat well and fast. What does that mean? When the woman shows up for treatment, at the center of treatment, how coordinated is our care? How comprehensive is our care? And are we actually utilizing the known therapies with the best outcomes? And that's the effectiveness, and that's where the publication comes from. Are we uplifting innovative care to ensure these women have the best outcome? And the third one, which is a very common misconception, is making sure there's continuity of care, meaning there's a coordinated pathway that this woman walks, whether in the urban area, peri-urban area, rural area. We remain very coordinated in how this woman is being managed along this pathway.
What is the role then of Roche in all of this? What specific solutions is Roche supporting to improve early screening and diagnosis across the continent, and also how the Roche is working with government and NGOs?
One word, Asanda, it's partnership. And as you see, there's three factors in the system that still needs to come true, and no single entity is able to achieve those outcomes on their own. And I'll start off by the three factors I've shared early. It's basically detect early, and I'll run through some of the programs we have across the continent. How are we making sure patients are detected early? I'll start with one of the collaborations we're having in Tunisia, where we're incorporating AI to ensure that more women are detected early and referred quicker into the system. The second one is in Kenya. I think you referred to that a little bit in terms of the Empower system. The Empower is meant to mobilize at community level women going to a center and getting their comprehensive diagnosis, detection, and referred into the system so that they have the best chance at the best outcomes when they're treated early. I would come as well into South Africa. In South Africa, we are collaborating and supporting through a platform called the Njani, which is a nurse-led community primary healthcare approach to ensure there's an early detection in this space.
I think those three examples, Doctor, we're going to leave it there because we're completely out of time, but they do paint a great picture for us to see what Roche is doing. Dr. Chilwesa, thank you so much for joining us again today.
Thank you very much, Asanda, and thank you very much, Peter. And as I said, I hope this conversation move into an economic conversation and not a conversation going forward.
Great. Dr. Paul Chilwesa is Head of Policy, Population, Health and Health Systems Strengthening at Roche Pharma Africa. And on that, we say goodbye as the Rise and Shine team for today. My name is Asanda Beda.
And I'm Peter Ndora. Have an awesome day. And if you're Mauritian, have a lovely Independence Day today.
And Happy Youth Day, Zambia.
Oh, yes, indeed. Yeah. So have a great day from me and Asanda. Happy Thursday. We leave you in the capable hands of Palisa and Benjamin.